The Center for Disease Control and Prevention estimates that between 2 and 10% of all pregnant women in the United States experience gestational diabetes. That is quite a number, considering how rarely the condition is talked about. But what exactly is gestational diabetes, you may ask? What are the causes, symptoms, and treatment options? Sit back, and I'll tell you all you need to know.
Welcome to Simplified Health Tips, your place for factual information about achieving and maintaining optimal health. I'm Andrew. Today I'm here with Michael. And as he already mentioned, we will be talking about gestational diabetes. So, tap the like button, smash that subscribe button, and let's go. Okay Michael, what is gestational diabetes?
Have you ever experienced increased blood sugar during pregnancy or know someone who has? Well, the good thing is, it is not an indicator that you had diabetes before the pregnancy or that you will have diabetes afterwards. It is called gestational diabetes for a reason. The bad news? If untreated, it can cause serious harm to your health and that of your baby. Like with other types, this form of diabetes affects your cell's use of glucose, which can lead to a spike in your blood sugar. There is another danger. Gestational diabetes can be a risk factor for type 2 diabetes. However, if you can keep it under check, control your blood sugar and the condition, through eating the right foods, exercising regularly, and even taking medications, you can go on to have a healthy baby through an easy delivery.
Please tell us about the symptoms of this condition.
Gestational diabetes has next to zero observable symptoms. Most pregnant women simply do not show any sign of the condition. However, you may notice a few mild symptoms including increased thirst, frequent urination, blurred vision, and fatigue. Like I said earlier, it may be difficult to tell if you have gestational diabetes. So, it is important to see your doctor the moment you start thinking about getting pregnant and having a baby. It is important to check for possible risk of gestational diabetes, along with other conditions. This initial check should develop into a routine diabetes check during prenatal care. If you're diagnosed with gestational diabetes, more frequent checkups will be required, especially in the final 3 months of your pregnancy. The doctor will need to monitor your blood sugar more often, as well as your baby's health.
What causes gestational diabetes?
It is normal for hormonal changes to occur during pregnancy. These changes make it difficult for your hormones to keep your blood sugar in check as they fail in their duty to process sugar you consume.
What are some of the risk factors that can lead to gestational diabetes?
Generally speaking, while it is hard to say why some women develop gestational diabetes and others do not, there are several risk factors to look out for. Risk factors for gestational diabetes include prediabetes or past gestational diabetes, overweight and obesity, when an immediate family member has diabetes, lack of physical activity or a sedentary lifestyle, polycystic ovary syndrome, previous delivery of a baby weighing 9 pounds and more. Women of Black, Indian, Asian American, Hispanic, and Pacific Island descent have a relatively higher risk of developing gestational diabetes than Caucasian women.
Are there complications that gestational diabetes may cause?
As with most other forms of diabetes, there are complications associated with gestational diabetes, especially when left untreated. For starters, unmanaged gestational diabetes can result in high blood sugar levels. And this can cause serious problems for you and your unborn child if not treated. For instance, you may even require a C-section to deliver. There are several other complications that may affect you and/or your baby. Complications to watch out for. Surgical delivery. This is otherwise known as cesarean section. Preeclampsia and high blood pressure. These complications are sometimes triggered by gestational diabetes and can cause serious issues if not treated. Diabetes in the future. You're more likely to develop gestational diabetes during a future pregnancy if you currently have or have had it in the past. This might also include type 2 diabetes as you get older. Complications your baby might be prone to. Preterm birth. This may either be recommended due to the large size of the baby or may be triggered by high blood pressure. Hypoglycemia. A baby may also be born with low blood sugar as a result of gestational diabetes. When this occurs, the baby should be fed promptly and maybe even given an intravenous glucose solution. Excessive weight. This does seem logical where the mother has high blood sugar. Overweight babies, over 9 pounds, may require a C-section, become wedged, or even have injuries. Severe breathing difficulties. Respiratory distress syndrome is another complication that may occur in babies born early by mothers with gestational diabetes. Future type 2 diabetes and obesity. The fact that the mother has gestational diabetes is already a risk factor for the baby. Obesity is another complication that may occur. Stillbirth. Unfortunately, a baby may die before or shortly after birth as a result.
What can women do to prevent developing gestational diabetes?
It's impossible to say a particular thing can prevent diabetes. Usually, a healthy lifestyle and choices should help. Those healthy habits like eating the right foods and exercising can help you stay free from diabetes, even during pregnancy. Also, if you have had gestational diabetes in the past, healthy life choices can prevent it from recurring in future pregnancies. Basically, the following choices may help. Eat right. Fruits, vegetables, whole grains and generally, fiber-rich foods should do the magic. Stay away from fat and calories. Be mindful of portions but strive for variety. Maintain a healthy weight during pregnancy. You should be intentional about getting pregnant. This includes losing extra weight beforehand and maintaining healthy habits all through. Stay active, whether it's a 30-minute brisk daily walk, biking or swimming, exercising before and during pregnancy can help you stay sharp and healthy. Other habits like walking to the nearby store instead of taking a ride can also help. Watch your weight. It is normal to gain a few pounds during pregnancy. But you should watch it. Too much weight isn't just bad for you, but your baby as well. How is gestational diabetes diagnosed? If you're at any risk of gestational diabetes, it is necessary to get a test between 24 and 28 weeks of your pregnancy. That's your second trimester. If the risk is high for you, a history in your family, obesity or overweight before pregnancy, the test should come early, usually during your first prenatal appointment. There are two major types of screening for gestational diabetes. These are the initial glucose challenge test, a blood test taken 1 hour after you drink a syrupy glucose solution to check your blood sugar level. A blood sugar level of around 190 milligrams per deciliter shows gestational diabetes. A normal blood glucose level is pegged at below 140 milligrams. The other test is a follow-up known as the glucose tolerance testing. Here, the solution contains more sugar and the blood sugar test is done hourly for 3 hours. Your doctor only needs 2 high blood sugar readings out of 3 to confirm you have gestational diabetes.
What are the available treatment options?
There are 3 major ways to treat gestational diabetes. These are lifestyle changes. These have to do with your eating habits and other mobility lifestyles. Just like prevention, you'll need to do certain things to treat your diabetes. These changes include diet. Eat more of fruits, lean protein, vegetables and whole grains. These foods are rich in fiber and nutrition and will keep fat, calories, and refined carbs at bay. Engage in physical activities. Apart from keeping blood sugar at normal levels, exercising regularly and engaging in physical activities can help prevent pregnancy-related discomforts like cramps, swelling and back pains. Monitoring your blood sugar. Your doctor may ask you to check your blood sugar multiple times every day during pregnancy. This should usually be early in the morning and immediately after meals. You must ensure your blood sugar level is within the healthy range. Medication. Medication might become necessary if diet and exercise have not brought about any improvement. Insulin injections are the most common type of medication for treating gestational diabetes. There have also been cases of oral medication, but some questions have been raised regarding its safety. Monitoring your baby. Part of your treatment also includes checking your baby's health frequently. This involves regular ultrasounds and other tests just to be sure the baby is growing normally. Post-delivery follow-up checks. Most cases of gestational diabetes usually disappear after delivery. However, checking your blood sugar 6 to 12 weeks after delivery is necessary to be sure blood glucose levels have normalized.
And there you have it. All your questions answered. If you have more questions, drop them in the comments section and we'll attend to them in good time. Don't forget to share this video with someone who may benefit from the information.
Thank you for watching to the end of our video. If you found the information helpful, please like the video. Also, don't forget to join the family by subscribing to our channel. See you next time.